Welcome back. We're continuing the news. In this evening's health report, Shamela Pullen looks at how first aid is used in a medical emergency.
The first response in an emergency is to provide the necessary first aid to the person who is injured. This is typically while the affected individual awaits emergency medical care.
For example, arresting hemorrhage with a bandage can prevent shock and death. Placing a limb with first aid in some kind of immobilizing apparatus can also prevent pain.
Consultant emergency medicine physician Dr. Eric Williams says Jamaica has come a far way in administering first aid to injured persons. But Dr. Williams believes more can be done to ensure more lives are saved. He thinks training needs to be provided at the community level.
I think if we have, as I was mentioning earlier, national approach that would add to the chain, because as you know, Shamela, in trauma and injury, we undergo a chain, a number of series that are in a chain from the pre-hospital area that is out on the field to the ambulance, then the emergency room, then the operating theater if needs be. So chain of survival, sometimes we call it, if we can have at each point some kind of interception of this chain, then the final outcome would be quite favorable.
Dr. Williams also has some advice for persons who are acting as first responders.
If a patient is awake and is able to speak to you, then we know the airway is unlikely to be in jeopardy, and that can guide us a big way, because airway injuries are priority in terms of assessing and managing patients. So if they are awake and they can speak to us, we feel a little better, and then we can go on to splint, tell the patient not to move to splint the limbs, and depending on your resources, certainly if it's an ambulance with oxygen, that can be done, and you reassure the patient that you are going to be okay.
With your health report, I'm Shamela Pullen wishing you good health.